Assalamualaikum. My name Nur Atika binti Muhammad Shah from BMI Cohort 1 Part-Time. So today I would like to share about radionuclide imaging and its comparison with other modalities. So radionuclide imaging is a method of producing image by detecting radiation from different parts of the body after a radioactive tracer is administered. It can investigate virtually any organ or tissue function in the body. With clearly defined goals and continuously feedback from radiologists and doctors, clinical departments, the possibilities of radionuclide imaging are almost limitless, especially in case of formulation particularly difficult diagnosis. So, principle for radionuclide imaging is begin with the administration of radioactive isotope. And then image acquisition when the patient lying down under the gamma camera or PET scanner. Radiations come from the patient's body. Imaging can be dynamic with the counts over seconds to minutes collected into frames and displayed as cine sequences. Principle for MRI is employ powerful magnet which produce strong magnetic field that force protons in the body to align with that field. It will show differences, type of tissues, and contrast agent may be given to a patient intravenously by request from the radiologist or depends on the imaging for depends on the body part. Different coil may be used to a different part and it is a non-ionizing radiation. Principle for CT scan, it is used radiation to build cross-sectional images of the body. It creates a comprehensive non-moving image of organs, bones and tissue. Radiation are used to make image by radiate them through the body. Contrast media may be given intravenously. Principle for ultrasound, it uses high frequency sound wave to generate an image. It is non-invasive diagnostic technique to imaging internal organ. The probe is covered with a thin layer of gel as a transmitter between area of interest and monitoring system. For the general X-ray, X-ray will penetrate body and tissues and allow images of internal organs. Use ionizing X-ray to produce image and does not using any So this is a component for the radionuclide imaging. Consists of a scope, gantry, camera head, positioning circuit and pulse height analyzer, PMT, scintillator crystal, collimator, scanning table and a computer. For component for MRI scanner, it consists of a RF coil, gradient coil, magnet, scanner, patient table and MRI console. For the CT scan, it consists of a laser, internal laser, scanner bore, X-ray tube inside the gantry. Gantry itself, control panel, internal, also get at the outside, and treatment couch. For general, it consists of a control console, erect bucky, X-ray tube, and table bucky. Also a cassette. For ultrasound, it consists of a display, user interface and keyboard, processor and transducer probe. Image formation for RNI, when radiation is released from the patient, it can exit at any angle and hit the detector in a location that doesn't correlate with the location of its origin. To overcome this, a collimator is used. Collimator is used in which only gamma photons that travel parallel to the collimator will be accepted. Those traveling at an angle will hit the septum, be absorbed and therefore not contribute the image. The collimator acts as a lens to reject photons that have a path. That means they do not hit the camera in a location that corresponds to their original location. It does not. The collimator does not reject scattered. So it consists. Next is a scintillator crystal. The crystal is a fluorescent. When a gamma photon interact, it releases light photon. a single crystal of sodium iodide with a small amount of thallium. The thallium will improve the light output. The crystal is 6 to 13 mm thickness, hermetically sealed in aluminium can. So the PMT consists of a 30 to 100 PMT sit behind the scintillation crystal. So the purpose of this is to multiply the small amount of light detected from the scintillation crystal to a large signal. Then this convert the current produced at the anode of the PMT to a voltage pulse. The amplitude of the voltage pulse is directly proportional to the charge produced at the anode and therefore the amount of light received by the PMT, which is proportional to the number of gamma photon that hit the scintillation crystal. Each PMT corresponds to a coordinate on the scintillation crystal. This is then mapped out onto a matrix. Each time a gamma photon that falls within the acceptable energy window is detected, it is mapped on to its corresponding coordinate within the image. Image acquisition is controlled by the user and may be terminated when preset number of current obtained or preset time passed. For the image formation for the MRI, hydrogen in the tissue become magnetized when placed in the internal magnetic field. A net magnetization that is initially aligned with the direction of the main magnetic field. A typical MRI examination starts with the transmission of RF pulse to disturb this magnetization. This is termed RF excitation and required hardware called transmit coil. The excitation process involves tipping the magnetization away from the longitudinal axis to the transverse plane, where it can then be detected by hardware known as receiver coil. After the RF coil is turned off, the magnetization undergoes process called realization and precision as it returns to its thermal equilibrium configuration. It is possible to detect the magnetization because the transverse component of processing magnetization induced an electromotive force in the receiver coil. This is detected as a MR signal. In MRI, the received signal can be specially encoded by the application of magnetic field gradient that are superimposed on the uniform main magnetic field. Excitation and detection modules are repeated until all data are collected. The data are recorded and processed to form an image. For the CT scan, it is distinct three-phase process. The first scanning phase produces data but not an image. Then the reconstruction phase processes the acquired data and form a digital image. The visible and display analog image is produced by the digital to analog conversion phase. There are adjustable factors associated with each of these phases that can have an effect on the characteristic and quality of the image. For the ultrasound, ultrasonic image formation created using a pulse echo method of ultrasound production and detection. Each pulse transmits directionally into the patient and then experience partial reflection from tissue interface that create echo, which return to the transducer. Image formation using the pulse echo approach required a few hardware components such as the beamformer, pulsar, receiver, amplifier, scan converter, image memory, and display system. For the general X-ray, the process of image formation is a result of differential absorption of the X-ray beam as it interacts with the anatomic tissue. The differential absorption is a process whereby some of the X-ray beam is absorbed in the tissue and some pass through the anatomic part. MRI storage for all of the RNI, MRI, CT scan, and ultrasound generally is same, which is stored in the packs using DICOM format, film hard copy also, and CD, DVD soft copy also. Just the ultrasound can also be stored on the paper copy. So the advantages of the RNI, this is the ability to image the whole body in a single sitting at a comparable short time, hence increased patient care with no added radiation burden to the patient. The dosage used usually small, hence minimal radiation burden to patients, personnel and environment. When compared with conventional radiology such as CT scan, MRI or ultrasound, The nuclear imaging able to give information on cellular activity at an earlier stage. Early diagnosis of disease coupled with associated timely therapeutic intervention leads to a better prognosis. By detecting whether lesions are likely benign or malignant, PET scan may eliminate the need for surgical biopsy or identify the best biopsy location. The RNR also have a disadvantages, which is use very costly and sophisticated equipment. There are known long-term adverse effects from such low-dose exposure. Radiation risk accidents are more likely to occur if safety precautions are compromised. Disposal of radioactivity waste, including that from the patient, requires special procedure. And it's require highly trained personnel to run the RNI. So that's all. Thank you.